Hi and welcome to Graduagent.com, student nurse vlog number 1. Graduagent.com is a study gateway for the healthcare student and professional. I am a second year nursing student in the UK and I'm going to present, yes, more presentations, on the topic metformin, the medication used in patients with diabetes type 2. Metformin is an oral anti-diabetic medication used for type 2 diabetes mellitus. It can be used alone or in conjunction with insulin. Metformin is also known in its generic form as glucophage and glucophage slow release. Metformin assists in maintaining the balance of glucose in the blood by decreasing the amount of glucose absorbed from food and the amount of glucose made by the liver. Metformin therefore decreases glucogenesis by accumulating peripheral utilization of glucose. It should be noted that metformin is to be used with caution. Please take a look at the second bullet point and read the details. I will explain the keywords used in the text. Serum creatinine. Serum being any clear bodily fluid. Creatinine is a byproduct of muscle activity. Its genesis is creatine phosphate, where it becomes a waste product in the blood which is eliminated in urine. Serum creatinine is a blood test that will track the function of the kidney. Glomerular filtration is the first step in urine formation. The human body requires blood to pass through the kidneys to keep it clean, and the measurement of how clean the blood is as it is passed through the kidneys is proportionate to the speed it is filtered. Lactic acidosis is a buildup of lactic acid in the blood, causing nausea and weakness. NICE, the National Institute of Clinical Excellence, notes that metformin should be avoided in a patient with suspected tissue hypoxia, e.g. recent myocardial infarction, acute cardiac or respiratory failure, sepsis, and significant hepatic impairment. Initiation metformin should therefore take into account the contraindications just noted. Finally, monitoring a patient prescribed and taking metformin should be done to check renal function via a regular serum creatinine test. This should be done at least once a year in a patient with normal renal function and twice a year in a patient with serum creatinine levels at the upper limit of normal. And blood glucose control should also be monitored via an HbA1c test. The full text is available and is found at my blog, graduagent.com. Thanks so much for listening. Take care. Bye.